Hello, everyone. It's so great to be back again with the Flint Community Webinar, your community resource every Friday at noon. Today's partnership is brought to you by Michigan State University, the Healthy Flint Research Coordinating Center, MSU Extension, Educare Flint, and we've got the Flint Odyssey House here with us today. So we've got an exciting agenda for everyone today. We're bringing in a few really important experts. Dr. Omari Young got caught up in the OR, but we might get to hear from him today. We've got Shane Jackson, a community nutrition instructor with MSU Extension, who's going to talk to us a little bit about some community resources. We've got Kristen Centers Young, who's director at the Flint Odyssey House, who's going to talk to us about prevention services. We've got Janelle Jamerson, who's executive director about Educare Flint, who's going to talk to us all about their interventions. And Dr. McCoy White, who's going to talk to us all about the work that she's been doing in Flint around maternal health and how we keep our pregnant patients healthy. So we've got a big lineup for you today, and we're excited to get into it. We're going to start by talking to Dr. McCoy White, who's done so much great work in the Flint community and is going to talk to us about how we keep our pregnant patients healthy and some of the interventions and work that she's been doing along that line. Dr. McCoy White, how are you?
I am great. Thank you for having me and
Yes,
having me on. So I'm excited today.
Well, we're excited to hear from you. Tell us a little bit about some of the work that you're doing. I know that you've got a couple of projects, some around getting the word out about vaccinating our pregnant patients, some about how we just keep that population of people healthy. Just talk to us a little bit about some of the things you're doing in Flint.
Yeah. So I am on two projects here in Flint. And one, first, the one with vaccinations of pregnant people in Flint is what we call an apathon. And so we develop content. You don't need any coding. And so with that one, that is just talking about the efficacies of vaccinations, the safety of vaccinations, as well as vaccinations for infants as well. We're promoting that. And so we did that. We had an apathon in July. For that reason, and we built content. We had community members come in. The actual source that we use is called SciS 3.0. It's a computing information system that you actually don't need coding. It's already coded, but then you put information in, and that one went really well. That is also targeting maternal health and pregnant individuals for vaccinations. The next project that I'm on is called Miracle, and it's a multi-level intervention study that aims to reduce African-American maternal morbidity and mortality. And so that's 3 levels with that one. And so the level 1, we work with the enhanced prenatal and postnatal care services, such as maternal infant health program and Healthy Start, making it more available, making sure that everyone is utilizing it that is eligible to utilize it, as well as just getting the word out that it's there in the community to help with reducing infant mortality, low birth weights, as well as helping the birthing individual health as well. And then our level 2 is where we provide maternal health focused anti-racism training for anyone who's working with pregnant or postpartum women. And so that's a full day of training. There are CME credits and CEUs for individuals. So that's a good thing for that one there. And actually the individuals who do the training are from the community here in Flint, from CBOP, which they do that training every 6 weeks. And then the level 3 is where I work closely with healthcare providers and other agencies to implement community care patient safety bundles, targeting maternal health disparities throughout the county. This is the community care, which is the outpatient providers, the enhanced prenatal, postnatal care services, and community-based organizations. And so this is actually a research that's done nationally through AIM-CCI, which is 5 piloted counties, and we are in conjunction with Grand Rapids, Kent County in that area to actually move the needle for African American maternal morbidity and mortality. And so the bundle that we are pushing this for 2022 was postpartum bundle, which is to implement really CDC Hear Her campaign and also other postpartum care that is not being actually projected for people. So I'm working with Dr. Young, Dr. Omari Young and residents, as well as Dr. Pokerel and Dr. Brian Tesler at McLaren with their family medicine residency, just to get that word out and understanding that Hear Her is a major campaign because of how many individuals die. So far that what they've seen is approximately 852 women passed in 2021 because of pregnancy-related complications. And what had happened is they saw that majority, 66% of those related deaths could have been prevented. And they are seeing that it was because they were not heard. So that is one part of it. The other part is trying to set up a systematic referral to MIHP and Healthy Start and really getting that word out, how to get individuals help. A majority of the ones that are hit with it are low income, but also there's also still and yet African-American women, no matter how much money they make, as everyone saw Serena Williams, who almost passed, would have if they wouldn't have listened to her and found out that she had multiple clots. But there's others and countless others. There was a pediatric resident who unfortunately was not heard, and she passed right after giving her birth to her child. So those are things that we have to start doing, is trying to listen and trying to implement ways in which we can help postpartum individuals to get the needed care, but also those who are eligible for MIHP, which is the Maternal Infant Health Program, to get those resources to them. So here I am working with Genesee County, all 3 hospitals in Genesee County, the Genesee County Health Department, Maternal Child Health Network, the WIC program, and of course, the Maternal Infant Health Program here in Genesee County and Healthy Start program here in Genesee County, and also Revive Village Community Health Center, Greater Flint Health Coalition chat as well. So these are things that we are really trying to work with in agencies, and now trying to push out to outpatient OB/GYN offices to get this word out, to get to as many people as possible, to get this word out on how to help. But every year, this is a 5-year
study
commitment.
Yeah.
Yes. And so 2022 was postpartum, and 2023 will be maternal mental health is the next bundle. And just so happened, we were going to have another apathon in February in conjunction with the medical students from the MDPH program and community members, and that one will be on mental health as well. And so it's just great that we are trying to get community involved and also trying to get healthcare involved in how we can move the needle for individuals.
It's amazing how you talk about the community organizations that you've partnered with to make this all possible, right? Like you mentioned CBOP, you mentioned a couple of community agencies, you're working with local WIC, you're working with a lot of different partners, the 3 hospitals, to really make sure that the community is engaged in the efforts that you're doing, which is so commendable. Talk to me a little bit about what it looks like when you go in an office and you're talking to a provider and you're saying, look, these are the maternal mortality rates. We had over 800 women die, 60% of which were potentially preventable deaths. This is the work that you need to do. What does that training look like?
So what that looks like, first and foremost, is giving them the numbers. I have realized that if you show them here's raw data. This is what is really taking place. And this is why we see this as a need. No one, should perish because of something that we should have heard them from. But here's the numbers and what can we do? And here is what, number one, this was in conjunction with ACOG and CDC. And this is what we are given to patients to say, hey, if you have any of these signs, go straight to the hospital, go right to the ER. Don't even think about it. Show them the paper. Let them see that your physician is saying, this is my stamp of approval. And so a lot of the physicians, once they start seeing that, they're like, this is true. They are supposed to go straight to the hospital. And why aren't we doing this? Why hasn't it been moved sooner? And it's going, well, we don't know. But now we know. This is the connection.
And that data is striking, right? So it kind of makes you stop and pay attention. You said ACOG, and I know everyone might not know that acronym like we know that acronym. Would you mind telling people what that is?
Yeah, so this is the American College of Obstetricians and Gynecologists who sat and gave their stamp of approval of the warning signs. But they also sat down and wrote out how to speak to your physician when you feel like something is wrong. And that's something that is really needed in any setting, not just for pregnant individuals, but also just anyone for your primary care. Because it's true. It's hard to speak to your physician sometimes because you don't want to be seen as I'm the problem patient, or I'm the patient that always has these issues and I got to come tell you. So, but then they said, these are the things that you need to say. And this is how you say it, So.
I think that's super important information, right? Is how to talk to your physician, right? We've got, books on how to do lots of things, but how to ask the questions and how to make sure you get your voice heard. You had a question in the chat. Someone said, it's so nice to hear about maternal and infant health. There were many babies who were made and born during COVID. Is there any information about mothers' prenatal care, health of babies at birth, etc.?
Yeah, so actually this is actually for mothers at birth. So when we look at these numbers, these are from mothers who are just having during the time that they're pregnant and then right after. And so we say about a year after is these numbers. So we go from prenatal up into postpartum. Mm-hmm. And we're actually looking throughout. And so what we found, there is a Texas Congress, she's Texas state representative. And what happened to her was a hear her. She was having her child, and of course she was over 35. So that's a geriatric patient.
That's so offensive.
They call that a geriatric pregnancy. Once you're
I'm so offended. I turned 37 yesterday. I'm like, that's painful. Continue. Sorry.
I had a child after 35, and the first time I saw that, I was like, I'm not a geriatric. And they're like, yeah, you are. But it's okay. But they didn't hear her, and so for a time, she was having issues with breathing, and during that time they say you're tired, and so you have to make sure that you just relax. It's okay. She had just had an epidural, and she was like, no, I feel like I'm going to pass out. I can't. And what happened? They found out they put the epidural in the wrong spot, and it was a nurse who looked at her and was like, something is off. With her, look at her, something's off. And then they were quickly having to take the child and do so much because the epidural was running to her heart, so it was going to stop her heart. And so those are the things like that. Those are the stories that we hear that you don't hear. You hear about Serena Williams because of who she is, and I'm glad, because that helps move the needle and spread the word. Because we don't want that. We want to make sure that everyone is safe when they're having their child, but and at the same time, please voice your concerns, during that time, and let that be a safe space for them.
So it sounds like you're saying if someone finds themselves in a space where they are worried, right? They're concerned, they have some worries about their care. Are there any key phrases, keywords, things that you found in the literature and in your work that people should use or say?
So actually the running buzz is this is a hear her.
Okay.
And so this is something that they are getting out even more across the nation. This is something that we have to hear. We're
Okay.
not listening. Let's listen.
Yeah.
And so when they say this is a hear her, then that's a key word for the physician to turn to be like, okay, I need to listen.
I love that because we use that language in medicine already, not necessarily hear her, but those buzz phrases, right? Like, I'm concerned. If Nurse T is available, I'd love to hear her kind of feedback on this, as she's in the community and she has kind of been in spaces where we understand there's language that we use that says everyone stop for a moment. Like, we need to, there's something going on. I know she was out in the community and might be, oh, nope, you're right there. Hey, Nurse T. Have you noticed any change in the language and the spaces that you're in that really highlight maternal mortality concerns and how we really say, no, we need to pay attention?
I think just from the women just sharing their true perspective and how they feel. A lot of times, because of the stereotypes and the past experiences of healthcare providers not listening, but I love the hear her, hear me, hear what I'm saying, being able to express what is important. I know a lot of times in the community, one of the things that I strongly educate on and encourage the community to share is what matters to you. So what matters to me is that I have a healthy baby. What matters to me is that I can overcome the stereotypes. What matters to me is that I can deal with whatever issues that's in front of me as long as I can get to the results of having a healthy baby.
That's
So
amazing.
That's why I want to come interject.
Yeah, that's amazing.
That's
Nurse T, you mentioned that here, like, the community just wants to be heard, right? And I think that hear me kind of dovetails with that sentiment that you're hearing. People in the community want to make sure that their voice, their point of view, their perspective is heard. And it sounds like the work that you've been doing, Dr. McCoy-White, really highlights this sort of national intervention that does exactly that. That says we need to hear people, right? That highlights that hear me. So I think that's amazing work. Before you go, I know, Dr. McCoy-White, I want to be thoughtful about your time and I want to be thoughtful about our next presenters. We are going to be talking about community health. And I wonder if, as a transition, you talk a little bit about the work with WIC and some of those partnerships and what that has looked like to be thoughtful about how we get nutrition to pregnant mothers or pregnant individuals.
Yeah, so working actually with WIC, we've been talking to them about really pushing MIHP, the Maternal Infant Health Program, and asking, how can we be of service to help, number one, not just with the hear her and the signs and warning signs of when they need to go to the hospital, but also what other resources they need here and how can they, so WIC will talk to them and educate them about nutrition and about breastfeeding and about all the different things. And so we're saying, so how can we be in partnership? And so we actually work closely with the Maternal Infant Health Program and Healthy Start so that we can then start moving that needle in, okay, so what does the mothers need during that time? And what are the best ways that they can do, for those who are thinking, well, I do want to breastfeed. So what do you have to do? And I'm not an expert, so I can say that. But being one who went through a lot and asked a lot of questions about breastfeeding, the first thing is, increase your water intake or increase, certain foods that will just help you overall, healthy foods.
Right.
But then that helps with increasing yourself to make sure that you have, the needed supply for your child, but also the needed supply for yourself, because this does, drain you and this does take away some things, but you're actually putting it back in when you eat these certain foods, or when you're drinking your water, and when you're taking, your supplements to ensure you have this for the child. And so that's what we've been doing, really trying to work closely with them, and how we could be of service and with the resources that we have in the community. And also with Revive Village, they're also another great resource here in the community, that they are teaching the same things as maternal infant health program, and doing home visits and case management as well.
I love that. Thank you so much. I know Dr. Gordon had a comment, and I wanted to make sure we got her perspective. She's out in the community listening to people, and I wanted to hear her perspective.
Hello, everyone. I just pretty much want to reiterate that, like the Hear Her campaign is, which is excellent. Making sure you know the signs, some of the urgent things to go into the hospital for, and also keeping a journal. They say up to 12 months after your birth, like any type of complications, and your family, bring your family members in as well. And each of your family members or your partner needs to know the signs, symptoms, and not being, to reiterate, be confident. Be your own advocate. If something does not feel right, speak up and keep speaking up until you're heard. Do not leave. If you have to go to another hospital, if you have to call a physician, because your life is on the line when you have these complications, and they can quickly, turn deadly. So things you want to watch out for is the urgent maternal warning signs are, you want to help manage your underlying health conditions like hypertension, diabetes, depression, recognize unconscious biases for healthcare providers, and make sure it's a two-way conversation that you have. Write down all your questions when you go to your physician or your OBGYN that you have. And if you need someone there with you to reiterate what did they say. So improving your own health literacy. So just speak up for yourself. And thank you, Dr. Jolen. That's all I have.
Thank you so much. I
Speak
think
up.
that's such important. Oh, sorry. Go ahead.
I was just going to say on the end of this, just to say with this, we have also partnered with HFRCC for our apathon, in which we're pushing for maternal health equity as well with apathon. So we are grateful to all our partners here to do this work. And with apathon, there's an app that we can send out to the masses about those types of things, the warning signs, and how to get help and resources here in the community. So please be on the lookout for our next one.
Absolutely. Thank you so much for your much needed expertise and the work that you do, Dr. McCoy-White. Thank you, Nurse T. Thank you, Dr. Gordon. We'll be hearing from all of you a little bit later. Right now, I'd like to kind of piggyback on some of the concepts that Dr. McCoy-White was talking about in terms of starting with nutrition and starting with yourself and starting with how we get good resources for ourselves and make sure that what we're putting in our body is healthy and how we access those healthy resources. So I'd love for Shane to come up and talk to us a little, Shane Jackson to come up and talk to us a little bit about her work with MSU Extension. I'm going to preface this by saying that Shane is a little bit of a famous rock star in our community. She's like, where you Google her and you find all of these awards. We are so lucky that she was willing to share with us some of her time. Thank you so much for being here. I want to end by talking a little bit about some of the work that you're doing that's not related to nutrition, but if we could start talking a little bit about your efforts and community resources around nutrition, that would be amazing.
Thank you guys so much for having me. Nutrition is my life. I am actually at the extension, which have actually been here since it was established in like 1941. So we go way, way back. Extension was actually put together to actually improve lives through education process. So that means we come into the community, which we're in 81 different counties. That means that we actually meet you where you at, and we come in within, like, as we say, layman terminology. The main focus of extension is actually doing education from programs designed to help not only youth, but our adults in the community to actually get us all healthier, safer, and happier, and having more productive lives. We have so many different programs on extension. A lot of people do not know that, all the way down to we test soil. We have a master gardener program. We have a community food system program, which actually is set up to actually from the farmer to the fork. So a lot of people actually one-on-one with farmers. We have a community development program, which we work with small businesses within the communities, from community to community, all over the state of Michigan. Health and nutrition, that's my baby. We have things that we focus on, as Dr. McQuaid was just saying, like nutrition. We have nutrition just focused on just for moms and moms only, from the very beginning of her finding out she's pregnant to the very, very end. What are you supposed to be eating? What do these trimesters consist of? What am I supposed to be putting inside my body? What do this do for my baby? And so within the program, you get things that you can actually use for your babies, like blenders that are free. Like these are neurites we give out to them to promote continuing to have fruits and veggies, grains inside their diets, things like salmon to actually for brain activity for not only you, but for baby as well. So, but we educate this in our programs, and we make it super, super fun. But then every time you attend, you get something to take away with you. Same as healthy food, healthy families. We're connecting healthy families together through food. Eat healthy, be active. That is for maybe the senior population, adult population that actually want to start getting healthy, and we're connecting the puzzle pieces together. Like, okay, I knew this part, but I didn't know this part. And so we come in and we meet you at, it could be a community center, it could be a school. We do Cooking Matters, which is teamed up with Gleaner down in Detroit. Cooking Matters for one, because, okay, the kids have left the house. What's next? How do I cook for me? Cooking for one person. And so we educate you on how to actually cook for just one person. We also have sci-fi, which is set up for educating not only our little bitty people, but they have teamed up with the court systems that now they are working with parents to educate parents how to be parents to their youth that actually have violated inside the court system. We have 4-H, which is a program that I love, because all of us is under this big umbrella for MSU, but they are focused on just the part of actually moving these children to the future. That means it may be things dealing with technology, it may be a science fair, it may be exploratory days on campus that you get to meet your Senate, your board, your governor, things of that nature. So it kind of gives the kids an opportunity to think outside the box. And then we focus on things like fruits and veggies that someone, especially in the office, if you see something strange inside the community, you didn't know what it was, or fruit or veggie, this person can actually break it down and explain to you what it is, where it came from, and what you can do with it, far as, you know, how to eat it or how to preserve it. Because a lot of us have a lot of food, and like, how do we preserve this stuff to push it so I can actually use it months and months later? So that's when we come into play, and that's when I come into play to teach you how to do these things, even to redo your whole entire pantry, because you're like, you know what? Out with the old and in with the new. How do I redo my pantry, and what does that look like for me?
Can I sign up for that?
Yes. So we come anywhere. We meet you where you at. Even if it has to be a one-on-one, we're going to meet you where you at, but everything is always under layman terminology. And what I mean by that is we have a special population that's just not reintegrating inside society, which is our inmates. I am the only one in my office that is focused on that. I believe in a second chance. I have teamed up with the Genesee County Jail, with Sheriff Swanson, with the IGNITE program. And what IGNITE stands for is inmate growth naturally and intentionally through education. So what I do is I come in to give them an opportunity to end generational habits that have been inflicted upon them, because now they're realizing that it's habits, that the way their mother mothered them is the same way her mother mothered her. And so you can't blame her for the mistake she made, how she fed you. But yet you can end it right here inside the jail to say, hey, I'm no longer going to eat the way I used to eat, because this may have a lot to do with a lot of behavior that I'm having mentally, because of the food that I've been putting inside my body. And so inside the jail, I educate mood with food. So everything that we put together inside the class has something to do with your mood and what it would do for your depression, what it would do for your anxiety, because there's certain foods you're supposed to eat. A lot of us are being misdiagnosed, ADHD, ADD, and a lot of us are going through, as you call it, NDD, nutrition deficiency disorder. And so that means I'm not eating all the proper things I'm supposed to eat. So that's why I'm all over the place. That's why I'm hanging off the ceilings. That's why I'm making the mistakes that I'm making. And that's why my brain is not snapping in the way it's supposed to, because I'm not giving my body the nurturing and the nutrients that it needs, because that's the most sensitive component of my body. So why not feed it the right way so it can work for everything else within my body? Because that's not my first brain. My first brain is my gut. And so we don't even take care of that in order for us to take care of the second one.
I love this is really important and useful information, and you just provide a wealth of resources for the community. So one, thank you for the work you do. I mean, doing the work that you do, it requires a lot of energy and it's a lot of work. And so thank you for all of that. Can you talk to us a little bit about like how we sign up for these services? You talked about some of the work you're doing in incarcerated populations. You talked a little bit about the work that you've done with Master Gardener programs and teaching people that. I tried to sign up for that in the pandemic because I thought I was going to grow a garden. Didn't really work out for me. But like, how do we sign up for stuff like that?
So that's nothing but a Google. You just
Okay.
Google MSUE, it comes up, and you can sign up for these programs all the way down to Surf Save. Because a lot of people want to go into their own food trucks now. We offer those classes for you to get Surf Save certified. Even first-time home buyers, we offer the class as well. We're meeting where you're at to actually promote and push you and excel you into the future. Because there's a lot of things we don't have the answers to, but this is like one of those key things inside the city of Flint that's so special that we have here is MSUE. And we provide so many things that people don't know we're here. But I hold church groups. I mean, and it's been in groups as large as 64, and 44 showed every 6 weeks with me. I mean, they beat me there. But it's all about removing your skin. One thing about Flint, you can't come in with, your business jacket on and high heels on. You have to be able to meet them with Air Max jeans and a t-shirt on and let them know like, hey, we are the same. We here for the same thing, the same vision, the same goal. And, I'm just trying to help move you forward in a healthy way. Even when we had the pandemic, well, I'm gonna go back to the water crisis first. A lot of us was not educated on, things that actually mitigate when it came to the lead. What is vitamin C? What is iron? What is calcium? A lot of people heard the words, but they never knew what it was. They didn't know what fruits and veggies provided these things. So that's when we came into play to actually lay it out and bring it in as a visual, like, hey, this is vitamin C, this is iron, this is calcium. Guess what? We're going to put it all together as a meal. And so each one of the classes we put together, I cook every single class. So you get to eat, but you also get to pass this from generation to generation, because we have the little bitty people coming up who's going to be in charge real soon. And so we want to make sure they're healthy, but also their bodies, but also their minds.
Absolutely. That is such important information. Thank you for providing those resources. I'm thinking like, I'm going to show up at your house in my Air Max jeans for dinner because that's apparently what I need to do. Talk to us a little bit about what it means to teach kids to eat well. Like, what does that mean? How do you, I have a 4 and a 7-year-old, and fruit snacks they think are healthy. We don't buy fruit snacks in my house. We try to keep it all whole vegetables and fruit, but tell us what that means for you.
It's all about actually getting on a level, because I have to get on a level, but also bringing kids in the mix of everything that you do. So if you're in the kitchen cooking, you bring your child in as you're doing spaghetti and give them a task to do. One thing about a child, the way they work, if they help you put it together, most likely they're going to try it because they help put it together. Never allow them to dwindle away from you and go watch TV or play a video game. Say, hey, I need your help with this meal in here. How about grabbing the spaghetti and I'm going to get the water started and you can put the spaghetti in. Matter of fact, I'm going to let you stir it too. Kids are known to be involved, more with actually making changes when it comes to their palate, when you actually introduce things, and never say, oh, that is so gross. Even if it's gross to you, make it so that it's so good to you. Like, oh my goodness, this is so good. You got to try this. I get my son every single time, and it may be the most gross thing I've ever tasted in my life. I'm like, you know what? His palate is different from mine. And so I have to be able to introduce things, even though I may not like them, he likes them, and it's okay. Even when I'm out in the community, I bring things with a twist, like instead of serving tacos on a shell, I'm gonna serve it on romaine wrap. Yeah. And so the kids are excited about that. Like, I've never thought to have it like this. But the more and more you introduce fun things for them how to eat certain stuff, the more eager they're going to be to try different things. And then come into the store and go into the farmer's market, take them with you and let them pick out some things. Say, hey, I've never tried this before. Have you tried this? No, mom, I've never tried it. And you guys just try it together as no thank you bikes inside the house. Kids, they go every single time. It just never fails. They're the
I love
easiest
this.
ones to trick.
I'm selfish. I love this. I could talk to you all day about this. Like, how do I get my kids to eat vegetables? That is amazing. This is really helpful. One of the questions that kind of relates to what's in the chat is if you've moved out of Flint but live in Genesee County, can we still access your services? The other thing, if you could piggyback on that before we move on to the next guest, is how do people like pay for fruits and vegetables, right? Like, we know they can be a little bit more expensive. Are there any resources that you have with MSU Extension that help people think about things like that?
But we do a tour at the farmer's market, and we actually take the whole entire market apart to show you actually how to pick out fruits and veggies because they come within season. So we explain to you when to buy them and then when to actually go frozen. Even though they're frozen, don't make them bad. You just have to be more leery of reading the label on the back of it to make sure it doesn't have a lot of sodium in it. And anything that you buy with fruits, you want to have it in its own juices. It has to be its own juices because it's natural. Soon as it says syrup, put it down. Because you have people now that are dealing with pre-diabetes, high blood pressure, things of that nature. And you want to make sure that you are reading the label constantly. When you go into the store, you'll notice when you shop and everything you see in your eyesight is actually all the bad stuff. And as soon as you start to bend down, all the healthy stuff is at the bottom. It was designed that way. And so that's why when you have your child in the cart and then you pushing them and they pulling all the junk stuff in, that's why they was designed that way, to actually pull all that stuff into the carts. But we can do this a healthy way. We at MSU, even though we are Genesee County, so we in Linden, we in Fenton, we in Sports Creek, we meet you where you at, no matter what school, what district, long as it's Genesee County, I can show up. You know, even if it's outside for a special request, I can show up because usually it's a special request with just me, but I will show up. But it's all about just educating, and everybody is looking for that, not the fountain of youth, but the fountain of longevity. And if I can guarantee you 8 to 10 more years of your life, you're probably going to have a seat and take my class and say, hey, I need those 8 to 10 years. Where do I sign up?
Hey, I want those 8 to 10 years. Where do I sign up? The last question in the chat before I let you go is, what if there's certain foods that you can't eat for a medical reason? What should people be thinking about when it comes to things like that?
So even like it's certain stuff, look, and it's so crazy because I know so much knowledge, and it's crazy because you have to take one of my classes to know everything. I mean, all the way down to blood typing and things of that nature. Even if we have people that cannot have soy, then you go oat milk. If you can't have almond, then you go soy milk. I mean, it's just so many different things, but that will be a class for you. Because just like, you know, if your sugar is running, if you're a person that craves sugar all the time, that's when you want to ask those questions to your doctor. Say, hey, can I get a full panel done on me? Because maybe it's magnesium is low and my, you know, copper is low. And maybe I need to incline some more broccoli, some more spinach. And now, you know, we're going through SAD right now because this is the time when people are dealing with seasonal depression. We are northerners. Guess what that means? The equator starts to tilt. And as it tilts, that means we are lacking sun. We need more vitamin D. And that means if you have to get it through a supplement or even that famous thing called the sweet potatoes, because it's a difference between the candy yam and it's a sweet potato. People don't know that. They always say, no, it's the same thing. It's not the same thing. So increase your sweet potatoes, things that's orange that actually have a lot of vitamin D. And this is the time for you to do it now because you don't want it. A lot of us will suffer from it because we are lacking that vitamin D.
I really appreciate your wealth of resources. I promised you a minute or two to talk about some of your endeavors and new things that you've got coming up. So please feel free to share.
So I'm wrapping up the jail as we speak. And like I said, that was something special for me to give them the opportunity to actually have a second chance. I have just been appointed by Governor Whitmer on the health committee for the whole entire state of Michigan. So I'm super excited about that. And looking forward to what my journey is going to look like come Monday, because then I know what all my job description is on Monday. 3 books, I'm a busy girl, so I'm all over the place. I'm gonna be flying to Jamaica and helping them out with a literacy program that they have and tying into nutrition with their literacy program. So it's just, I'm here, there, and everywhere. So
y'all better get to know Shane before she blows up and is super famous. And we're like, we knew her.
I am Flint first. I'm not going nowhere. This is my baby, and hey, I am here.
I appreciate it. Thank you so much for that wealth of information. We appreciate you so much. Thanks again. We're going to bring up Kristen to talk to us a little bit about recovery services in the community. Shane just talked to us a little bit about some of her experience with incarcerated populations and her experience educating them and getting them some resources. Can you talk a little bit about some of the resources you've provided in the community around substance abuse, misuse, and maybe even if it has led into providing some resources for incarcerated populations as well?
Well, right now, Odyssey House is really doing all of the above. We've been in the community for decades, mainly as a residential program. However, have extended into outpatient programming, recovery housing, prevention programming. We had youth prevention programming as part of the residential program because we had parents in residential. And of course, we want to break the cycle. Every parent wants to do that. And so we have extended that programming out into the general community. All of our prevention programming is very parental based. We believe that parents are the best prevention specialists in the house. So it's about teaching parents and role playing with parents, having those really uncomfortable conversations with their youth, specifically when you're working with teenagers that know that you may have or may be engaging in the behavior that you're telling them not to do. And so what do you do when your child throws your own behavior in your face? And let's practice being able to have those conversations, and also focusing on the role of fathers in maternal health, in sustained recovery. We have most recently started our 24/7 dads curriculum, and we had piloted that in a residential program, but it's a long curriculum. It's like 12 weeks. And so it exceeds the length of residential stay. And so we're looking at different ways that we can make sure that men are able to complete the entire curriculum. And that means following them every place they may go, which may be in and out of jail, in and out of residential substance abuse treatment, in and out of a lot of other programming. And then just having the facilitators as I guess you could say, community outreach, where they're actually following people around. I say that and I sound like we're stalking them, but just making sure that we don't define family and we don't define home when we talk about home-based services, that these services may be in a lot of different places and spaces that is the current resident of whoever we're working with.
That's amazing. So backing up a little bit, talk to us about Odyssey House, maybe its history, how it got started, and like how someone can link in with your services should they need to.
So Odyssey House really started in New York in 1966. We were both born the same year. That's how I remember that one. And then came to Flint in the 70s and is most recognizable as what it is now from the 80s. We started doing women's specialty services in the 80s because women were lying about their pregnancy status to get into substance abuse treatment. The fact that you would have to lie and pretend that you weren't pregnant, because the idea of a pregnant person in recovery for substance misuse was considered such a high liability, right? And then the dynamics and the stigma. Dr. McCoy-White really talked about that concept of hear her. You know, and we have historically had women that when we're talking about needing to go to the doctor, everybody says, well, they're just drug seeking, right? And instead of being able to say, let's sit down and really hear her and talk about, it could be drug seeking, but also what are we talking about? And that conversation should happen in the hospital or the doctor. Absolutely. And not the substance abuse counselor's office, right? And so as we developed out into that PPW programming, the pregnant and postpartum women programming, really start to wondering all the pieces and parts that come together. Accessing those services are really, we have a one-stop shop called the Community Involvement Center. And just contacting them, they would be able to do sort of a brief screen and then direct people as to who they would need to call for the next step. based on, addiction science and where they're at and what the services they need and how that falls within the curriculum, from residential, detox, outpatient, brief intervention. I mean, there's a full array, and recovery is a lifetime. So it's something that needs to be looked at and guided over years rather than some short acute care stages.
100%. So how does someone access Odyssey House? Would they be referred from another center, or like maybe they were inpatient treated for some substance abuse concerns, or is it someone that has identified that they have a concern and they can just come into you? Can you talk to us a little bit about that?
All of the above. We have worked
100%.
really, really hard over the past 10 years to reduce as many barriers as we can. There's not going to be all barrier free, because I mean, we do have, you're as medical professional, you've got to jump through some hoops for Medicaid, America, Blue Cross, and all that kind of stuff. But we have, we try to make it as barrier free as possible. And that's why we set up the Community Involvement Center. It's actually right across the street from the jail and the courthouse, on Beach and Court. You can walk in, you can call ahead, you can get referred, you can, just come in for pizza on Wednesdays and talk to somebody and maybe back out and come back the next Wednesday. But really trying to look at the way that we can engage people where they're at is how you come in. There will be things that you may come in, understand that this is what you want, and then have to go get pre-approval from a funding source and then contact GHS. And there may be different things that you have to do as part of the process, but really you can just contact directly on whether you're an individual or a referral source. We have a lot of extended family that just want to talk to somebody about what some options are before they start running the options past the person they're concerned about. And so just being able to do that too. I mean, we actually have to talk to the patient themselves at one point or another, but really just being able to understand what's available and how that they can access.
This is an amazing service you provide to the community. And as I think about that, I wonder if we can bring Nurse T and Dr. Gordon back up to see if what she has noticed and what they have noticed in the community relative to needs, and how maybe Odyssey House is already meeting those needs, and we can get the word out about that. Do we have Nurse T and Dr. Gordon? They might be busy doing working with the community. So, there they are. Nurse T and Dr. Gordon, Kristen has told us so much about the resources that Odyssey House provides, and that you can get into Odyssey House via many of these different mechanisms, whether it's they're leaving inpatient treatment at Hurley, or someone is realized that they need some extra resources and walks in on a Wednesday to grab some pizza and hear more about the resources that Odyssey House provides. What have you heard from the community in terms of resources that might be needed around substance abuse, and maybe Kristen can tell us how Odyssey House has some of those resources?
Yeah. So one thing about the Odyssey House, I can speak from experience. I used to work for the Odyssey House as a substance abuse detox nurse. So I can say that center or unit that I was on would help the community tremendously. A lot of people were able to walk in off the street, come in and help with their addictions and get them detoxed within the first 3 to 5 days of treatment, and then hopefully with an appropriate discharge plan so that they could go out and continue being free from their addiction. So I can speak from that firsthand. I have seen Ms. Neva out about in the community, and I know right now we do have a huge opiate crisis. And so I can say, as far as just being out in the community and working with the Flint Odyssey House, that it has been a great benefit to the community. I just think we need to maybe bring more awareness. A lot of our resources, they're like inner city, but a lot of community residents don't always think that they're available for them. And so I just think the more awareness we do, the more education, the more sharing of resources that's available, the better outcomes that we do have. But I can say that they do stay packed, and it's a great program as far as, while I was working. Actually, I miss working there.
And another thing is, Okay, sorry.
Go ahead.
Another thing is removing the stigma for like opiate disorder. The biggest thing is the stigma. It's okay to seek out help. It's okay just to recognize that you need help. And the Odyssey House is helping to decrease that stigma of that if you need help to detox and recognizing, the signs and symptoms if you're becoming an opiate dependent or have an opiate disorder, as they call it now. So both the main thing is removing the stigma. There is help out there. Just reach out if you see Nurse T or myself, the Odyssey House or other, detox or programs that are out there. But the main thing is there's no stigma, no judgment, and there's help available.
That is one of the points that Shane put in the chat. She said her offender population always stated that they just want to feel human and know that they will make mistakes. And Kristen, it sounds like Odyssey House is doing wonderful work in destigmatizing the need for resources, destigmatizing asking for help. And we just thank you. We have people in the community talking about how useful the resource is, and we want to make sure we get the word out about how amazing Odyssey House is in providing resources to the community. Thank all of you so much for this really necessary information and for giving us these resources. We've talked a lot about education, nutrition, how we keep moms healthy. Coming to us to talk to us a little bit about how we educate our kids and what that looks like in Flint is Janelle Jamerson with Educare. Thank you so much for talking to us a little bit about how we keep our kids educated and what resources you provide in the Flint community.
For sure. Thanks for having me. So if it's okay with you, I will share my screen, and I know that we're coming up on time, but I'm very excited to share a little bit more about Educare Flint as we are celebrating our 5th anniversary in the Flint community. So again, I'm Janelle Jamerson, and I have the honor and privilege of serving as Executive Director of Educare Flint. And one of the reasons I was so excited about accepting this invitation is because we genuinely see early childhood education as part of our public health infrastructure. I'm going to take a pause here just to make sure that you guys can see my screen okay? Okay. And so, we see early childhood education as a part of public health infrastructure. Educare Flint was created during the water crisis, along with its sibling school, Cummings Great Expectations, because we recognize that the impact that childhood-led exposure could have on children's long-term development, but also recognizing that public health professionals, that physicians couldn't write a prescription, right, to remove lead from children's systems. And so we knew that one thing that we could do is ensure that kids had access to high quality, intensive brain developing activities that ensured that during those first 5 years of life that we were able to combat the potentially dangerous effects of lead in children's systems. And so with that, happy to share a little bit more about Educare Flint and the Flint Early Childhood Collaborative. And so really just starting from what we know that children's brains develop connections faster in the first 5 years of life than at any other time in their development. We also know that there's a critical tie between the well-being of parents and their children's social, emotional, physical, and cognitive development. We know that policies and practices that support 2-generational approaches, and I heard a little bit from almost every panelist about working with both children and their parents, are essential to addressing the impacts of childhood poverty and the multiplier effects that childhood poverty creates for kids and families. We also know, not believe, but know that Flint can be a model for a seamless system of high quality early childhood education from birth through 3rd grade. And we also know that no single person or organization alone can solve our most significant challenges. And so our work with the Flint Early Childhood Collaborative is to leverage Educare Flint as a demonstration for the value of increased investments in high quality early childhood education, but we hope to influence improvements in the universal quality of early childhood education in Flint. And so Educare Flint utilizes the Educare model, and we're part of a national learning network. And our work starts with community linkages and strong leadership. And so Nurse T and I work together on the Literacy Network Steering Committee. I've seen a few different individuals, who we've connected with through Educare Flint and our early childhood work, because it's crucial that Educare Flint isn't on an island, but that it's truly integrated into community, that we're hearing the voices of community and how we operate the center, and also the practices that we're advocating for throughout the state. And we take all of that as data qualitatively, along with very structured student outcome data related to their language development and their social emotional outcomes, as well as their parents' perceptions of their development and of their family strengths. And we use all of that to build the capacity of our staff to provide services for children through high quality teaching practices, and for families through intensive family engagement. And the confluence of all of those components together, strong leadership, community linkages, data, and embedded PD, strong teaching, and intensive family engagement, all of those things together lead to strong outcomes for the parent and child, for the school and family. But ultimately, the goal is to increase students' academic achievement and readiness for kindergarten, and to help parents show up as their children's first and most important teacher, and make progress toward the goals that they have for their children and their families. Educare Flint is the only Educare school in Michigan, the first and only Educare school in Michigan, but part of a national network of now 28 schools. I think there are 25 dots on this screen, but I'm sure no one's going to count them. And our partnership is really made up of a number of local and national partners. And so when we talk about the importance of data collection, we're collecting data locally to see how are Flint kiddos doing, and to what extent is this model actually effective at increasing outcomes for Flint kids and families. And we're sharing that data up with our national evaluation partner at the University of North Carolina, the Frank Porter Graham Institute for Child Development. And we're looking at not only how are kiddos doing in Flint, but how are they faring across this network, where we are serving kiddos at higher levels of cost per student, to see how those increased investments are actually driving changes for Flint kids. And that's a 3-level study that we do, first looking at what's happening at Educare Flint and Cummings. And we've done that over the last 3 years. And I'll share a little bit about outcomes for Educare kiddos now that we're 5 years in. But then also understanding early childhood education beyond Educare Flint. And so in that second rung of our research efforts, we've really learned quite a bit about challenges that families face around accessing early childhood programs, around understanding what their options are. And then also just understanding what quality is, and recognizing that there are a lot of high quality options in Flint and Genesee County that currently exist. And then finally, working on ongoing engagement and dissemination. That's with policymakers, that's with program leaders, to figure out how do we again improve the universal quality of early childhood education in Flint and Genesee County. So as I shared, we are 5 years in at Educare Flint. We celebrated our 5th birthday on Monday. And again, it's a very momentous occasion for us, because the first 5 years, as I shared with you all, is critical in human development, but I would say also in organizational development as well. 17 children who started with us between 6 weeks of age and 6 months of age are now in kindergarten. So we celebrated our first cohort of kiddos who started with us and stayed with us for the full 5 years. But in total, more than 1,000 children have been served by Educare Flint and its sibling school, Cummings Great Expectations, since it opened in 2016. Cummings in 2016, Educare in 2017. I'm happy to report that students who are leaving Educare Flint and Cummings Great Expectations are entering kindergarten ready to learn. And that's evidenced by their receptive vocabulary, by their expressive vocabulary, by their social emotional development, and by their parents' perception of their child's readiness for kindergarten. But challenges do still exist for parents in managing that transition to kindergarten, as well as accessing early childhood programs writ large. And so the next 5 years, what we're looking forward to working on is developing interventions that improve kindergarten transitions for Flint kids. We were really fortunate to receive an Education, Innovation, and Research grant from the U.S. Department of Education to do just this, with a specific focus on not how do we get kids ready for kindergarten, but how do we get kindergarten ready for kids? How do we make sure that what's being offered in the kindergarten space is age appropriate and can support children from a number of backgrounds, some who may have had early childhood experiences, but also recognizing that some families may choose not to provide that for their children. We also want to just strengthen and demystify the pathways to accessing early care and education services. So we're partnering with the Genesee Intermediate School District to revamp the 591 KIDS system to be a coordinated enrollment system that makes it a one-stop shop for information, referral, but also application for a variety of early childhood programs. And then we want to expand plans to improve the universal quality of early childhood education in Flint. We want to make sure that no matter where a parent chooses to enroll their child, be it home-based care, family friend and neighbor care, or whatever type of professional who's supporting their child, that they are receiving the highest quality early care and education. So thanks again for allowing me to be here, and I'll pass it back to you, Jennifer.
Thank you so much. This is such cool data that you all have found, and such good information that you've provided. And just thank you for being such an amazing resource to the community and really working with kids and working to make sure our preschoolers are ready for kindergarten. I've got a preschooler, so I know what that looks like, and I really appreciate it. Thank you to all of our panelists. You shared such important information for the community, and all of the work you do is so necessary. We're super appreciative of all your efforts and all the work that you do. We're excited to be back next week. Don't forget, if you are a social worker completing continuing education credits, this is the information that you need, and you can complete this information to get your continuing education credits. We'll see you next week. Thanks so much.